Hello and welcome to Wellness Today. I'm Sheinelle Jones and we are bringing you some important wellness news to kick off the start of summer. We'll share details about recent medical studies with tips on how you and your family can stay healthy. Then learn to strengthen every step with a few easy exercises that will transform your daily walk. Plus, we'll learn why it matters to have an LGBTQ friendly medical provider. And I tried a popular form of relaxation for the first time. It is everything you need to know to take care of your physical and mental wellness this month. Research publishes every day, but what does that mean for you and your family? Joining us to explain everything from extreme heat risk to camp safety is NBC News medical contributor Dr. Natalie Azar. She's here to break down the details of these medical studies and how they impact our day-to-day life. I'm so happy we're doing this. Quite often we hear about studies, but then we don't hear the details behind them, and these are really good ones. Yeah. So let's start with the first one. It's associated with extreme heat and what it does for mortality rates.
Right, I know. So the extreme heat has been increasing now for a number of years. In fact, many states in this country are experiencing days that are over 90 degrees, many of them more than before. We have basically, usually we have a summer season of heat. It's starting earlier and it's lasting later. And this is really significant. So this was a research out of Penn that actually looked at this kind of stuff. And the things that we want to talk to people about here are the signs of heat stroke and what you can do about them. So it's important, Sheinelle, right? I think most people have a misconception that if you are having a heat stroke that your skin is going to be very wet because you're sweating a lot.
Yes.
And that's actually not true. Your skin actually becomes very dry, very red, and very hot. You know, the #1 symptom of a heat stroke is a core temperature of 104 degrees or more. But guess what? Most of us don't have a digital thermometer. Right, exactly. So obviously fainting, feeling dizzy, things like that, and having that dry skin are signs and symptoms of a heat stroke. Okay. So what do you do for a heat stroke? The #1 thing, and I really want viewers to understand this, is to call 911 first. Because if you suspect a heat stroke, you need to get that person medical attention quickly.
I think people underestimate the severity of it. Exactly. They can just, cool down and it'll be okay.
But you don't want to do that. Always err on the side of caution. And then you move the person into a cool shaded area, remove as much clothes as you can, and then a little trick that I think is so helpful. Let's say you're at a picnic and you have ice packs, right? You put them under the neck, put them in the groin and under the arms. A lot of blood vessels there.
Wait,
and
under the neck?
Under the arm.
Under the arms
and in the groin. And there's a lot of blood vessels in those areas, and that can help people cool down. You're not supposed to put people in an ice bath.
Which people do.
They do. The only people who can really do that are people who are like athletes who just did a vigorous, a run or something like that, and they can handle it, but most people should not be put in an ice bath.
Those are the kind of things we'll always remember that now. I know I will. All right, so moving on to another study that grabbed our attention, summer camp safety. A lot of parents obviously preparing to send their kids to summer camp. I know I am. We all want our kids to have fun, but we also want to make sure they're safe.
Yes.
What does the research say?
So this was a study out of the University of Michigan, and they polled parents, and you're going to be a little bit surprised by these statistics. Less than 50% of parents who were polled said that camp safety was a priority for them. And only 1 in 10% said COVID precautions were important. You want to know what the most important things were?
What?
Cost, location, and activity. So it's kind of like, where are your priorities, guys? But I get it, right? We've all sent our kids to camp. There's a lot of things to take into consideration. One of the things that I think is really important to understand is that camps will say whether or not they're accredited by the American Camp Association. But you want to follow that up and confirm that they really are. And a really great resource is the American Academy of Pediatrics website. It's called healthychildren.org. They have numerous resources about camp and camp safety. Like, think of your kids, right? Like, my daughter has migraines. Is the camp equipped to handle that? Are they equipped to handle the mental health needs of your children? These are all things you want to know, right? You're entrusting.
Especially if it's a sleepaway camp.
Especially if it's a sleepaway camp. So a lot of good information out there for parents.
Good. All right, the third study, team sports and mental health. Speaking of summer activities, it looks at the connection between team sports and mental health in our kids. This is a hot topic.
A hot topic on so many levels. So this was a study, again, this was from Cal State. They looked at kids between the ages of 9 and 13, and they found that the children who participated in a team sport had better mental health parameters, let's say, in terms of anxiety, depression, and stuff like that, as opposed to kids who either were not in sports or who were participating in, an independent kind of sport. But I think immediately we might say, okay, that's important, team sports are important, but what about all these news things that we're hearing?
That's what I was thinking, I'll be honest.
Exactly.
I mean, it seems like we're hearing about the pressure, especially for college athletes.
So when does good cross over and become not so healthy? So, it's kind of like a little bit of that Goldilocks, right? Not enough isn't good, but maybe too much isn't good either. And experts say that for sure the college athlete has a tremendous amount of pressure and stress, right? They're managing school and travel, and they have to keep up their scholastic and their athletic performance. So they have some unique challenges, but I think this is a lesson for all of us. And Sheinelle, I know you have kids who are teens as well. A lot of pressure for these kids to perform athletically. We need to be paying attention to their mental health too, and not just to assume that they're okay with all the stress that we're putting on them.
That is so important. Okay, another important story, the study that grabbed our attention, speaking of kids, it talks about the dangers of inappropriate antibiotic use with kids. We've heard that sometimes we overuse them. We call the doctor and we say, can you give me an antibiotic for my kids?
Right. So there's a few different things that are concerning about overuse of antibiotics. One, of course, is antibiotic resistance, right? We know that's a big thing. Expenditures, you're going to the doctor, you're missing school, you're missing work, right? I mean, there's a lot of dollars that go into this that are unnecessary. And also people have side effects from taking antibiotics. There are actually numerous ones. And probably one of the biggest things that I find that is a problem is that kids are getting antibiotics maybe for a virus, and they never needed it in the first place. And guess what? They get a rash. And then they live their entire life saying, I have a rash to penicillin. That sticks with them through their adult lives. That's a big, big problem. The take home, I think, for parents here is that you need to advocate for your children, and not to discount the importance and the role of the pediatrician in making a diagnosis and treating appropriately, but you as the parent need to say, just want to make sure my kid really needs this antibiotic, right?
So it's a two-way street. It's not always the parents saying we want it. Sometimes do the doctors just prescribe it?
Exactly. And you have to advocate for the kids, right? Because they're young and they can't do it themselves.
Another good one, a survey that finds that most men think they are healthier than others. And let's talk about those annual health screenings. Father's Day is coming up. It's so important.
So this is a Harris poll. I love these stats. So 33% of men polled say that they don't need to go to the doctor every year.
33%?
33%. 65% said that they thought they were healthier than like the average guy next to them. 38% get their health information on social media, and 38% put their pets' health before theirs.
Wow.
Aren't those interesting numbers?
We have some work to do, but yet I believe it.
I know.
Sure.
But here's the thing. So do you actually have to see the doctor every year? Believe it or not, the literature's a little bit mixed on that as to whether or not seeing your doctor every single year is necessary. I would say in middle age it becomes much more necessary. You do want to establish that relationship. It's always easier to take care of someone when they're sick, when you know them when they are healthy.
You're so good.
You're so lovely.
Dr. Azar, now she should actually go help with patients.
I'm going to go see my patients now.
So thank you. Good information.
Thanks,
for sure. Thank you. All right, coming up, the exercises to help you take every moment in stride. And later, I'm hooked. I loved it. I tried a sound bath for the very first time. We're going to tell you all about it, all that and more just ahead on Wellness Today. We're back with Wellness Today, wellness news you can use. It is Walking Month here at the Today Show. Research suggests that there are endless physical and mental health benefits to taking a walk, from lowering your resting heart rate to feeling more energized. Our dear friend Al Roker even walked his way to the finish line of the Brooklyn Half Marathon. Now, fitness expert Stephanie Mansour is going to help you put your best foot forward with a few strength exercises.
Thanks, Sheinelle. I'm Stephanie Mansour, and I'm so excited that you've joined us during our month-long walking challenge. I want to show you a few exercises that'll help you build strength and avoid injuries as you take more and more steps each day. First, we're going to start with the squat. Start with your feet as wide as your hips. We're going to pull the abs in and sit back as if you're about to sit back into a chair. Now, I'm going to show you this from the side, but I want you to make sure that when you're looking down at your toes, your knees do not go past your toes. That's a common mistake. So we want to keep the knees back, lead with the glutes, sink the tailbone down, pull the abs in to support the low back, press down through the heels to stand up. Next, we're going to move on to our marching bridge. So we're going to lie down on our backs and come into a bridge position. Now, this works the hamstrings and the glutes, which are important for helping you walk more efficiently and effectively. So in this position, with the feet close to the hands, we're going to slowly lift the hips up. The lower back comes off the ground and the middle back. You want to make sure to pull your belly button in towards your spine like someone's touching you with a sharp object and you're trying to pull that navel in, because this is going to help us with stability in the core and also make sure that we're not dumping and putting pressure on the low back. You only have to lift up about 1 inch or 2, or if you're more advanced, you can lift up higher. Pull your abs in and keep your hip bones steady rather than shaking from side to side as you do this move. We need to really keep it stable and in control. Next, we're going to move into a plank and then a downward facing dog. So coming into a plank position, we're going to start on our hands and knees and line the shoulders up over the wrists. From here, we're going to tuck the toes under and lift the hips up into a plank position. Pull the abs in and reach the heels towards the back of the room. Make sure that your back is in a straight line. For a modification, you can lower down onto your knees. Then from the plank position, we're going to pull the abs in and lift up and back into a downward facing dog. Press down through the hands and externally rotate the shoulders as you reach the hips up and reach the heels towards the ground. Now for a modification here, you can open the hands a little wider, fan the fingers out, and open the feet wider and bend the knees. If you want to do the full modification, you'll go from the half plank right here, and then you'll tuck the toes under, lift the hips up, and press back with the hands open wide, the knees bent, and the tailbone reaching up towards the ceiling. Not only are we building that core strength, but we're also building that flexibility in the backs of the legs. Now next, we're going to do a seated oblique twist, and that's going to help us with the internal and external obliques, which are great when we're walking and pumping those arms. So sitting up nice and tall, hands behind your knees, take a deep breath in, and then exhale, pull the abs in and roll down just slightly. Have the hands at the center of your chest, and then twist to one side, back through center, twist to the other, back through center. For an added bonus, you can squeeze those inner thighs together to really work your entire core. Next, we're going to stand up and move into one of my favorite exercises, which is a knee raise into a backwards leg lift. So we're working on hip flexor mobility here. So if you're looking to take longer strides or if you're looking to walk faster, building that strength and the mobility is key to helping your walk feel better. So hands on the hips, we're going to lift one knee up at about a 90-degree angle, and then slowly shift your weight forward and extend that leg back into a backwards leg lift. Slowly balance. If you need to, you can touch your toe on the ground. Come up with that knee, 90-degree angle. Pull the abs in, slowly lean forward, reach the leg back, engage the glute and the hamstring. One more on this side, abs in tight to help guide you. Good. And exhale and come to center. And then finally, to round this strength training workout out, we're going to go into calf raises. So standing with your feet as wide as your hips again, hands on your hips, we're going to lift up onto the tiptoes and lower down. Up onto the tiptoes and lower down. We're strengthening the backs of the legs. So in doing this multifunctional workout routine, we're helping you build lower body and core strength so that you can walk and feel like you're moving more freely. And also, this is going to enhance your walk and enhance the strength in your entire body.
Thanks, Stephanie. It's never too late to get moving. Join the Start Today community on Facebook and follow along throughout the rest of the month to find inspiration and motivation to get walking. All right, coming up, celebrating Pride Month at the doctor's office. And later, the instruments and melodies that help me find a new level of relaxation. Right after this. June is Pride Month, and all month long we're honoring the LGBTQ community. It can be challenging for anyone to find a physician that understands your unique needs, but especially for LGBTQ people. So for that reason, we've invited two experts to talk about best practices for finding a friendly provider for both physical and mental needs. We have Dr. Barbara Warren, the Senior Director of LGBTQ Programs and Policies at Mount Sinai Health System's Office for Diversity and Inclusion, And Dr. Ming-Hao Liu is the director of the Friedman Transgender Program at Lenox Hill Hospital, Northwell Health. Good morning to both of you, or thank you guys. I'm so used to saying good morning on the Today Show. This could be any time of the day. I think it's so important to set this up about, maybe for both of you, the biggest challenges facing the LGBTQ community, because I think sometimes if you're not walking in someone's shoes, you don't even recognize that it is a challenge in the first place. So can you put this in perspective for other people as to why this is so important to discuss?
Absolutely. So I think one of the biggest challenges is even getting access to a knowledgeable and sensitive provider. We often say that prevention is the best medicine, and if people are not getting access to care, then people in the community are not getting screened for conditions that can be more prevalent, such as heart disease, STDs, including HIV, and certain types of cancers. In addition, I think another major challenge facing the community is mental health and also intimate partner violence.
I didn't even think about that part of it, too. So, again, you have the physical part of it, and you also have the mental health aspect. What would you say about why this is so important?
I think to follow up on the idea of prevention and getting routine health care, particularly good primary care, so that it doesn't end up being an acute or a crisis in your health. I think one of the things that we really emphasize at Mount Sinai in training our providers, and also is a huge issue in the LGBT community, is the concept and the impact of minority stress. And minority stress is any kind of stress related to being a marginalized or targeted minority, as many LGBTQ people still are. And it's really important for LGBTQ patients and people to understand that even if they have access to great affirmative care and in pretty good health, the accumulated stress or the secondary stress of worrying about or anticipating discrimination, prejudice, violence, some of the anti-LGBTQ sentiments and laws that are being passed now increases your risk factor for many, many diseases, because what happens is when you get stressed, your heart rate increases. You have cortisol that's sustained over time, and as we know as healthcare providers, that can lead to all kinds of chronic health conditions. So it's really important to be aware of that, and it's important for your providers to be aware of that, particularly when they're doing preventative and wellness care for
it. It makes a lot of sense. If you can't walk into a physician's office and talk to that physician and be your full self and be honest about your life, your lifestyle, all those things, that physician can't treat you, effectively. So with that said, Dr. Liu, let's break it down. How should someone go about finding an LGBTQ-friendly provider?
That's a great question. So one can do a basic search on Google, find providers, and research more about the providers and the services they offer. Sites like ZocDoc also offer for people to search on their directory specifically for LGBTQ plus friendly providers. In addition, GLMA, which used to be known as the Gay Lesbian Medical Association, also has a free nationwide provider search tool for LGBTQ plus friendly providers. But really, what my patients have found to be perhaps even more helpful is that they go through social media channels such as Facebook, Instagram, Twitter, and sometimes Reddit, and they get referrals from other people in the community who've actually seen these doctors or other healthcare providers and been very pleased with the experience.
So then let's take the next step. Then once you find a provider, how can you ensure that that person is a good fit for you?
Well, one of the things I think it's important is to check out the website of the organization or the healthcare system that provider works for.
Okay.
If they don't have an LGBT-specific page or referral service or information, or they don't advertise themselves, for example, as an LGBT health equality leader, many healthcare systems now ascribe to the LGBT Healthcare Equality Index, which is a national benchmarking survey conducted by the Human Rights Campaign Foundation, which really helps hospitals and healthcare providers put all the things into place that make LGBT healthcare affirmative and effective in their hospitals. Also, to look it up, find out, are they an LGBTQ healthcare equality leader? Do they have an LGBTQ healthcare website? Also, when you get to the office, to look around before you even meet whoever the provider is going to be. Are you asked for your sexual orientation and gender identity, your partner status, on your intake forms? Is there LGBT visual things in the office? Do they have pride flags? Do they have The Advocate, the national LGBTQ magazine, is part of their magazines on display? Do they have pamphlets? All of these are signals that this is an environment that knows that LGBT people come to them. They want it to be visible. They want it to be welcoming. And so those are all clues too. But I agree with Dr. Liu, referrals from knowledgeable providers and also friends in the community can be really, really powerful and important.
That's so helpful. And, you know, we talk about it a lot in the bigger cities, but in some of the rural areas too. I mean, you know, this is obviously people watching all over the country. It's important to try to have those resources. Thank you guys both so much for coming in, Dr. Warren and Dr. Liu. Thank you.
Thank you.
Of course.
All right, when we come back, the transformative relaxation experience that helped me find my inner peace. Welcome back to Wellness Today. I am so excited to debut a new segment in this show where I'm going to try some of the trends, classes, and activities that I'm most curious about within the wellness space. As the school year comes to a close and I'm shuffling my kids to their end-of-year activities, I wanted to see if I could find some inner zen with a sound bath, and it had a profound impact. Take a look.
The melodies of the singing bowls and the vibrations of the gong echo through the halls of the Ohm Center on the Upper East Side of Manhattan, where I tried a sound bath for the first time.
So let's start with the basics. What is a sound bath?
A sound bath is where you are experiencing being bathed by all the sounds that are created from different kinds of instruments. The goal is to help you enter into a deep state of relaxation. Sound baths are a gateway into deeper meditation.
Suzanne Hill, founder of the Ohm Center and my guide for the sound bath, began meditating on her own at 17. After years of working as an acupuncturist and encouraging her patients to try meditation, she began teaching herself and opened this space in 2019.
What difference are you seeing in the people who you help?
They are so much more relaxed. They seem much, much lighter, like the burdens of the world are lifted. Even if nothing has shifted in the external world, internally, they've cleansed, and so they feel better.
Since this story is about trying a sound bath, what should the takeaway be for people who are interested?
Not to be intimidated by it. It doesn't have to be a spiritual or religious experience. You're just having a relaxation experience.
And before long, it was my time to try and rest.
I am not quite sure what to expect. I'm going to try. I don't want to fall asleep, which I can do pretty easily these days, but I also am looking forward to feeling something that I haven't felt before. You know, I've meditated before with calm, but I've never done a sound bath, so my heart is open to receive.
I'm going to have you lie down.
Once I entered the room, Suzanne handed me an eye mask and encouraged me to let go of the worries of the day.
And just allow yourself to sink into the ground. Be aware of the ground supporting your body, so there's no part of you that has to hold yourself up.
Then she began playing, creating a symphony of sounds.
Crystal bowls have a cooler sound, and the alloyed bowls have a warmer sound, and we like to mix them together. We also have a 40-inch symphonic gong, which is very grounding. When you play the gong, it's really about releasing any negativity. Singing bowls are more nurturing and nourishing.
She transferred the bowls to my hands to feel the vibrations as she played. As the sound bath finished, I felt better, and that sense of calm reverberated through the rest of my day.
That was really great.
Yeah.
That was great. It's like I was at a spa.
Music and sound is very healing, and I think that's why people are gravitating to sound baths now. They don't want to intellectually figure out how to feel better. They just want to experience feeling better.
I don't think it was in my head. It's hard to explain, but I really did feel more calm and relaxed, even in the hours and even the couple of days after. After the sound bath, I let what usually bothers me, running around and the hustle and bustle, I let it go. And I'm telling you, I'm really looking forward to going back and doing it again. So if there's one in your area, maybe you should try it. Find some ways, frankly, any way to relax. And I'm glad I got to learn about this one. Thank you for joining me to learn all of the wellness news you can use. I hope you found it inspiring and motivating to learn about how to take care of ourselves and each other as we ease into the official start of summer. I'm Sheinelle Jones, and we'll see you next time on Wellness Today.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.